Well, hello, my name is Ayadela Anishe, and I'm with the Milken Institute. And I'm joined by my colleague and friend, Merit Falzian. And we're here today to talk to you about something that we call both hard work and heart work. And so before I get started, I just want to take us on a thank you tour. So I want to thank the Robert Wood Johnson Foundation, who has graciously funded this project and has been working with us, as well as the California Healthcare Foundation. I also want to thank Learning from Communities and the Policy Consortium for having us here. And I want to thank you all for being here and listening to us and what we have to share with you today. Next slide, please. Before we get started, I do want to do a land acknowledgement. This work has been done with the National Academy of Medicine, and in particular, the Leadership Consortium. And so we are based in Washington, D.C. And I just want to acknowledge that the National Academies gathers on the traditional land of the Piscataway people and the Anacostans, past and present. And so we honor with gratitude these lands and the people who have come before us. Next slide, please. Just very briefly about the National Academy of Medicine. We are seen as a trusted advisor to the nation and to the world. And more specifically, the Leadership Consortium focuses on a learning health system. And so we see a learning health system as one that combines science, data, how we pay for healthcare, and then how we think about culture, which is the equity part of things, as well as how we engage people and the community. And I just want to underscore the importance of that piece about equity and engaging the community, because without it, we really can't get to health in the way that we really want. Next slide. So I'm excited to talk to you about this project that we have called Assessing Meaningful Community Engagement. That's actually what brings us all here today in terms of meaningful community engagement. We've heard words like meaningful and trust throughout today. And so I want to talk just a little bit more about that. Next slide. And so when we are talking about authentic and meaningful community engagement, I think all of us recognize that that is absolutely critical and it is necessary, especially when we're talking about health and healthcare. And my personal belief is that everything that touches on health and healthcare should be done in collaboration, in connection, with shared power with community. And so what we are seeing is that many groups over time, more and more, are starting to engage with communities in various ways. And so we recognize that even though this is happening, there are measurement practices that need to be understood so that we can get to understanding whether engagement is happening and whether it's happening in a way that is meaningful and impactful. And so we realized that there was a need for a strategy and there was a need for resources, because it is not enough for someone to say, I am engaging with the community and say that there is trust or that there's capacity building or that there's shared power if we're not asking the community, do they feel engaged? Do they feel that they trust the people that are sitting at the table with them? And so we wanted to produce some work that would help to support that. Next slide, please. So for this project, our goal was to think about how we might be able to build a menu of effective, evidence-based, and community-engaged indicators and metrics that could be used to help us understand if meaningful community engagement is taking place. And so I want to just do a little bit of a deep dive on some of the things that you see here on this slide and some of the words. We say build a menu. It is very easy to think that we could find a one-size solution in terms of the indicators and the metrics that should be measured. But we know that if you've seen one community, you've seen one community. So we wanted to make sure that whatever we did allowed for people and communities and collaborations to figure out what was going to be best for them. So we wanted to build a menu, almost like a buffet, right? You get to pick and choose whatever you want and what's going to be important to you. The other thing that was really important in our work was that we knew we needed to sit at the intersection of community evidence and scientific evidence. And that if we were going to do this, we couldn't do it any other way. So what I hope to be able to share with you are indicators and metrics that really sit at this intersection of science and community. Um, and then we wanted to make sure that these indicators and metrics could really address the needs of individuals, families, and community groups in a wide range of settings, and that they could be used to really track if engagement is happening, how well it's happening, what progress is needed, and what are the next steps that could be done, and that it could really help to shape health and healthcare policies and programs. Next slide. So when we started having some conversation about who we wanted our project audience to be, we thought, okay, well, we could focus on academic and research institutions, but that was going to be very limiting. We knew and know that there are so many different areas that touch health and healthcare. And so we wanted to be expansive. And so on this slide, you see that there are many potential audiences that we feel could be using our resources. So if you are doing engagement in any way, we feel that these resources are for you. So you could be a federal, state, or local agency, a territory or tribal community. You could be a community-based group or a community member. And then I won't read through the rest of this list, but I do want to highlight that while we use the terms health and healthcare, we realize that there are a number of systems that also impact health. And so we're talking things like housing, transportation, and education. And so if you are an audience member that sits in these other systems, know that these resources that I'm about to share are also important and relevant to you in your work. Next slide, please. All right, so we had the honor and privilege of working with a group that we call our organizing committee. And these are the smiling faces that you see on this slide. And some of them will probably look very familiar to you, including Merit's, especially when you see her on the screen. But we started out with 15 committee members, and 4 of them were community leaders. And when we started to take a look at what we were trying to accomplish for this project, meaningful community engagement, we knew that having 4 out of 15 community leaders represented was not going to be enough. So we actually increased the number of community leaders to 17. So that was something that was really important for us. So in addition to community leaders, the organizing committee also consists of researchers, human-centered designers, and policy experts. And you can see from this slide that this is a very diverse group. We wanted diversity across geography, race, ethnicity, nationality, ability status, sexual orientation, and gender identity. And that was something that was important to you. And in addition to Merit, also, I know Kellen Baker was mentioned earlier this morning, and he is also on our organizing committee. Just to show you that there are a few names that might be familiar to you. On the bottom right-hand corner, you see an open space. I'd like to say that we did that intentionally. It is not intentional. However, we believe that anybody who uses our resources is now part of the organizing committee. And so if you are using our resources, either your individual face or a picture of your community should go here as you are joining us on this journey. Next slide. Before we got started in our work with the organizing committee, there were a few things that we needed to really take care of and address. And so one of those was, how are we defining community and how are we defining meaningful community engagement? And so we think of community as not just being defined by geographic proximity, but also how people who share similar situations, similar issues, similar strengths, similar challenges can be brought together to focus on those. And so that is the broad definition of community that we use. We also define meaningful community engagement as something that really creates change, right? And these definitions are taken from the principles of community engagement, the 2011 version that was done with the CDC. And so in order to get to meaningful community engagement, there needs to be changes and shifts, tectonic shifts in how we mobilize resources, how we influence systems, how we change relationships, being a catalyst for changing policies and programs and practices. And if you're not seeing these changes, then I think it's important to really question how engagement is being done. Next slide. So after we thought about what are the definitions, we also wanted to have a foundational strategy for how we approach this work. And so you see on this slide the 8 strategies that we thought about for advancing this work. And I'll just highlight a few of them for you in the interest of time. So the first is we wanted to be able to define the ideal of what should be measured in meaningful community engagement, not what was actually readily available. So we did a literature review, and we'll talk to you a little bit about what we found from the literature review, but we didn't want to base the ideal of community engagement on what the science said was available and what had been measured. So we actually spent a lot of time with our community leaders and our organizing committee talking about what is important to you. What do you feel should be measured, regardless of whether there are indicators or metrics to actually measure it. The next strategy that I'll talk about is that we really wanted what we produced to be really flexible because we knew that there were a range of audiences who were going to come and use these resources. We knew that people were going to want to use them in very different ways. And so we wanted to be able to share resources that would allow for flexibility for the particular purpose that people wanted. The last point that I'll make is just really about the importance of equity. We wanted that to be the foundational element of what we were creating, and that equity was woven throughout our work. Next slide. So what I'm going to share with you over the next few minutes are several of the resources that have been developed for this project. So I'm going to share with you first our conceptual model. I'm going to share with you impact stories, and then I'm going to share with you our assessment instruments. On the right-hand side, you see resources that are highlighted in green. Those are tools that we hope will be useful in terms of communicating and disseminating the work that we've been doing. And one of the points that I want to highlight is thanks to Merit, we now measure time in terms of baby elephants. And so you may not know this, but the gestational period for a baby elephant is 18 months. And so this work originally started out as an 18-month project. And I would like to say that by now, we, instead of birthing one baby elephant over 18 months, we are now probably birthing about 3 or 4 baby elephants because this work has actually taken a ton of time. And it's not surprising because we know that with engagement, building trust, it takes time. And we wanted to make sure that as we were producing these materials, that they were developed in collaboration, in partnership, and co-created with our organizing committee, and that we were really getting at what people would want and need. Next slide, please. So the conceptual model. So we first started out looking at frameworks and conceptual models to see what was available. We didn't want to reinvent the wheel if there wasn't a need to. We looked at probably 20 to 30 different frameworks and conceptual models to see if we could find one that would allow us to think about community engagement at its center, at its core, focus broadly on healthcare policies and programs, and also incorporate diversity, equity, and inclusion in addition to outcomes. Now, I have listed off a whole host of things, and as you can imagine, we couldn't find a conceptual model that kind of hit all of those things. And so we decided to create a new model. And I will say, even before I share this conceptual model with you, that this model is complementary to existing models. This should not replace other models. Even Project Brotherhood's model that we heard about earlier today aligns with the conceptual model that I'm going to share with you. Next slide, please. So as we were thinking about the conceptual model, we went through several prototypes. And I do have to give a shout out, to use a technical term, to Kim Irwin and her colleagues who helped us in designing this conceptual model. And I am not showing you the box images with arrows that we actually started out with because that wouldn't be fair because we are not designers. But we went through 8 different iterations. And it wasn't until we got to the 6th one that we really felt like we hit the sweet spot of a model that was really dynamic and tying together engagement and outcomes in the way that we wanted. Next slide, please. So I'm going to share with you the conceptual model. So we start with community engagement because that is really the center and the heart of the work that we're doing. And that for those who are measuring or working on community engagement, it should be the center as well. Next slide. Then we know that there are core principles that need to be heavily engaged and involved in the work. So trust, co-creation, co-equal. Next slide. From there, we identified and worked with our organizing committee to identify about 70 outcomes that they thought should be relevant. 70 is way too many, so we actually started creating categories. And so we identified that once you have community engagement at the center, you have your core principles, then you need to get to strengthen partnerships and alliances as one domain. Another domain is expanded knowledge. The next is improved health and healthcare programs and policies. The next is thriving communities. Underneath each of them, you see what we call indicators that help us to understand if we're on the right track. So under strengthened partnerships and alliances, we've talked about some of the things that would be important to understand and to measure, such as trust, shared power, structural supports for community engagement. And so these are the things that we've incorporated as outcomes in our model. Next slide, please. And we believe that once you have community engagement, these core principles, and you're able to address outcomes that range from strengthened partnerships and alliances to thriving communities, that we can get to health equity through transformed systems for health. We also recognize that there are a whole host of various contexts that many of us operate in. There are the drivers of health, drivers that actually result in changes in health and healthcare. And then we cannot forget the social, political, racial, economic, historical, and environmental context that influences the work. But we believe that if we're able to actually influence and impact these community engagement outcomes and change health equity through transformed systems for health, that we can change the context that we live in. Next slide. So that was very quickly our conceptual model. And I also want to talk about the other 2 resources, but I'm going to breeze through them just in the interest of time. And if you have any questions, I'm happy to come back to them. One of my favorite quotes is that, and I've modified it a little bit, data are patients, people, or community stories with the tears, struggles, strengths, and impact wiped away. And so what we need and wanted for our work were stories. We wanted compelling illustrations and experiences and approaches that demonstrate how the use, evaluation, and impact of meaningful community engagement has inspired action. And so that was important to us. Next slide. So we wanted impact stories that were accessible, authentic, and contextual. Accessible in that we used a variety of different ways of telling stories, videos, audio clips, and text. Authentic, we wanted to make sure that we were getting to the heart of the matter rather than skimming on the surface. When we talk about, well, what did you do to engage? We didn't just allow people to say, oh, we engaged. We actually wanted to drill down more deeply into what they did to engage. And then context. We realized that this is just a snapshot in time of one or 2 people in a partnership, and that there are more stories, but this is just one context. Next slide. So for our work, we have 7 impact stories that cut across a range of geographic locations, communities. Some partnerships have been in existence for 1 year versus 17. There were also multiple ways of engaging. And so we hope our stories demonstrate that. Next slide. Next slide. And I also want to highlight that as we were telling these stories, we relate it back to our conceptual model. So you can see how the stories think about their outcomes, how they think about their core principles, and where there's alignment. Next slide. And then the last resource that I'll talk to you about are our assessment instruments. And this was important because we were trying to figure out how to assess meaningful community engagement. So in order to do that, you actually need measures or instruments that are community engaged, evidence-based, and effective. Next slide. So we did a literature review. We used terms to capture engagement, measurement, health, and we actually looked at publications that were released through February 2021. Next slide. So we started out with just over 1,400 articles, and through a process of widowing it down, we ended up with 37 articles that represented 28 instruments. And so, next slide, please. We really wanted to make sure that as we were thinking about instruments, that we were not presenting over 100, because that's too many for people to be able to think about and use, but a smaller number. And so the two things that we did to prioritize to get to 28 instruments was that we wanted articles that when they were talking about the development of the instrument, there was a community engagement in the development, either in the implementation or the evaluation of the instruments. And then the instruments also had to show psychometric properties. So they needed to have validity and reliability testing. As I said earlier, we want to be at the intersection of community evidence and scientific evidence. Next slide. And so we will be releasing a toolkit that has the 28 assessment instruments that includes how the assessment instruments align with the conceptual model and the specific questions. So if you are interested in measuring trust, you will be able to go to these resources and see which instruments measure trust, and you'll be able to see which questions you can ask. Next slide, please. Now, we know that there's a lot of information here, and so we wanted to share just some thoughts on how you might be able to use these resources. Next slide. I won't go into detail here, but I will just say that we wanted the resources to be flexible. And so we just encourage people to take a look at the resources, talk through them with the people that you're working with, talk about what works, what doesn't. If it doesn't work for you, scratch it out, right? If it does work for you, reflect on it. Focus on, shared understanding of language. Think about what you want to see in your partnership and what you want to measure, and figure out the best ways to do that. I'm going to turn to you, Merritt, now to talk about whatever you would like in terms of how we engage the development of these resources or anything else.
Thanks, Layadola. It's always so impressive to hear you talk about this project. It was an amazing process for me. I'm Merritt, and I've been involved in community engagement for a very long time, especially community-based research out here in Eastern Colorado on the High Plains. It's rural, and also, as one of our groups said recently, also known as people who are hard to reach. It was new to work with the National Academy of Medicine and work like this, and it was incredibly enriching and hard, and really, it worked for me. It was great. It was super engaging. And you've been saying this all day. You know that work like this cannot be done. And I know I'm reiterating this, but it's important to say that work like this, where we're diving deeply into community engagement and trying to figure out how we want to really talk about it and how we might assess it, that in order to get there, we too had to have really long conversations around principles and values and trust and what is community and what are our intentions and equity and cultural respect and engagement versus empowerment, and on and on and on. These were long and engrossing conversations, and kudos to the Academy's team who were able to take these wonderful voices who had really important perspectives and be able to shift and adapt and sort of make this into something that wasn't maybe what they intended from the outset. This intentionally iterative process gave us something that's not linear, gave us a tool that is cyclical, it's dynamic, that was something that we wanted, and it's useful for all kinds of different people, also something that we wanted. I want to share a quote with you that I happened to jot down in the 3 gestational cycles of baby elephants, that this was a careful and intentional process with intense work, but also a kind and collaborative process that often deviated from the original path and intention. So I want to share how we're starting to see this be used. And we've started to introduce this model, kind of like we're doing with you today, usually in longer venues, to groups like the Practice-Based Research Network gathering that happens in DC in the summer. We've also shared it with the North American Primary Care Research Group, a group that is doing tons of community-based research in order to help them see ways that they might study the impact stories, think about the core components that are important to them, and start to assess in order to show what we're doing. I'm also starting to share this work with groups that are working in engagement cores for the Clinical and Translational Science Awards. And these, some of them are gigantic and some of them are, but many of them are really grappling with how do we really engage around community engagement? How do we understand the value of our work? And here's what I have noticed these groups doing. When they see this model, specifically the beautiful flower model that's so cool, I see them start to hone in on what they think the big picture is of their work. It allows them to put words to what they think they're trying to do, to create a dialogue among themselves, to visualize what the possibilities are, to determine the focus of their engagement, to find a pathway in order to proceed, to measure and learn along the way in order to adjust, gain understanding, and make improvements. So that feels pretty real world, especially when you're talking about something like community engagement, which can be as wonderful and important, and how it needs to be right at the core and central, can also be a bit nebulous and hard to define and a bit complex. And so I'm starting to see this tool as kind of this background around forming a better understanding of what these robust partnerships might be, and to move forward with some kind of a bit more intention rather than kind of the flying by the seat of our pants methodology that so many of us have gotten so good at over the years. So we intentionally made these tools to be accessible to all sorts of people and to be user-friendly. And there's going to be a ton of information in the background. And so I'm going to stop there, and I want you all to have time to ask us a few questions.
All right. Well, I am here to facilitate the Q&A. I am checking to see if we've got any questions. And we do not. I have a question. It's good to see you, Ayadola. So I'm curious about the 17 community leaders that you brought in for your organizing committee, or can you talk to what that process, I guess, for recruitment was like, and sort of a little bit, I know some of the names that you had mentioned, Kellen, but I'm curious how convening such a diverse group in terms of experience, geographic location, probably their own lived experience and their interest and what they wanted out of this work. Can you talk to what that process looked like and some of the challenge you probably experienced along the way?
Yeah, so, I will say that we had a very good, 15-member organizing committee to begin with. And so we asked them who they thought should be engaged. And many of them just reached out to their networks. I think they trusted us enough to be able to contact the people that they, had been working with, many of them for a number of years. I think Merritt and a colleague of hers went back for, 17 years or something like that. So they trusted us enough to be able to bring into the fold the people that they had been working with for years. And then it was up to us at the National Academy of Medicine to facilitate and build our own relationship. And it was important for us to hear and listen to them and to give them time to talk about, what their experiences were, what they felt was important for community engagement, and to make sure that we were connecting with them like early and often. We did not do everything right? So, to have started a project and 6 months in, invite more people to it that should have been with us at the start, that certainly wasn't the best approach. But we have, I think, always been open to having dialogue and hard conversations. And we talk about what's possible and what's not. And I'll let Merritt add, because she's been, a part of this process as well.
Yeah, I completely agree, Ayadola. And that's a great question, Jamie. One of the things that I noticed that was such a core tenet to community engagement was this ability to open the dialogue, to listen incredibly carefully, to digest, to come back to the group with the knowledge and the information that they had heard the time before, make sure that what they heard was right, give chance to kind of process and comment yet again. Not that we were reopening the conversation and starting over again, but to just sort of to check in, right? It was about relationship building, trust building. And it's part of what took so much time. But it kept people coming and kept people engaging in the conversation. And each time the conversations would just get a little bit deeper, but yet we would also move forward and make progress in the hard work that we were doing.
Great. We did get one question in the chat from my colleague Shanta. Have you seen these tools used outside of the research environment among other entities interested in community engagement?
That is a great question. So we are asking people to talk to us about how they are using these resources. I know that our organizing committee members, there are some of them that have taken the conceptual model to their partnerships, and these are outside of academic research partnerships, and they're starting to talk about, well, what is most important to us, which core principles are we going to focus on, which outcomes are we going to focus on. So I do think that we're starting to see, the uptake of these resources outside of that, community-based participatory research, academic research partnership. And I think we're looking forward to when the National Academy of Medicine actually hosts a webinar, which should happen soon, that starts to talk about how others are using these resources. But I think that we need to test it. We need to have people use it and talk about what their experiences were, because our hope is that everything from the conceptual model to the stories to the assessment instruments, that these are ever evolving and that they're improving over time. I will also just put a plug in to look out on May 16th. We will be releasing the remainder of the resources. So the conceptual model is the only one that is publicly available, but on May 16th, you'll have access to the impact stories and to the instruments. Merritt, also, I give you a chance to.
No, I don't have anything to add there. That was perfect.
All right. Well, thank you both for this work and for sharing your journey over the past 18 months for this work. I think that we are ready to turn it over to our final presentation, The Power of Community, a Research Partnership in Alaska.